Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about 3D bioprinting, a revolution in medicine. What is it? 3D bioprinting is a cutting-edge additive manufacturing, AM, process that combines 3D printing with biology. It involves the layer-by-layer accumulation of biomaterials and living cells to create 3D tissue-like structures. How it works. The process starts with computer-aided design, CAD, of the desired tissue. A mixture of biomaterials and cells, known as bioink, is then printed using an automated dispensing process. The primary goal is to create functional, complex tissues and organs that can be used for repair, regeneration, and as models for research. The materials used in bioprinting, called bioinks, are crucial for the success of the process. They must be biocompatible, biodegradable, and printable. Natural polymers. These are derived from living organisms and are known for their high biocompatibility and biodegradability. They provide a pleasant and secure environment for cells to grow. Examples include gelatin, good for cell adhesion but has poor mechanical strength. Alginate, fast gelling and low cost, but offers poor cell attachment. Collagen promotes cell attachment, but is mechanically unstable. Synthetic polymers, these are chemically synthesized, offering high robustness, dominant microstructures, and measured degradability. Examples include polyglycolic acid, chemically adaptable and simple to process. Polycaprolactone, a cost-effective polymer with good rigidity and biodegradability. Polyurethane, a biodegradable elastomer with great biocompatibility and mechanical strength. The success of bioprinting depends on the bioink's physical and chemical properties. Printability, the ability of the bioink to be accurately dispensed and maintain its shape after printing. This is influenced by viscosity and gelation kinetics. Biocompatibility, the material's capacity to function with a suitable host reaction without negative consequences. It should support cell growth and be replaced by the body's own tissue over time. Mechanical properties. The bioink must have enough structural strength to maintain a 3D structure and support cells as they adhere, multiply, and differentiate. Viscosity. The thickness of the bioink. A balanced viscosity is needed to ensure smooth printing without harming the cells from excessive shear stress. The main 3D bioprinting techniques. There are three primary methods for stacking and structuring bioactive entities. Droplet-based bioprinting. How it works. Tiny droplets of bioink are precisely deposited onto a surface. Pros, high speed, low cost, and high resolution. Cons, requires low viscosity bioinks and is prone to nozzle clogging. Extrusion bioprinting. How it works, a continuous filament of bioink is extruded through a nozzle. Pros, can use high viscosity bioinks and print at high cell densities. Cons, lower resolution and printing speed compared to other methods. Laser-assisted bioprinting. A pulsed laser is used to transfer biomaterials from a ribbon onto a substrate. Pros, very high precision, resolution, and cell viability, greater than 95%. No nozzle, so no clogging. Cons, high cost and a complex setup process. Biomedical applications, tissue and organ regeneration. Bioprinting is a promising solution for the global organ shortage and the limitations of traditional tissue engineering. Bone. Bioprinting can accurately duplicate the intricate architecture of bone tissue to repair defects. Materials like alginate and polyglycolic acid are used with bone marrow stem cells. Cartilage. Since cartilage is avascular and does not naturally repair, bioprinting offers a way to create functional cartilage. Bio inks containing alginate and nanocellulose have been shown to be successful in boosting cartilage extracellular matrix, or ECM, deposition. Skin. Bioprinting allows for the creation of multi-layered skin. Research has shown that the in situ bioprinting of autologous cells directly onto a wound can lead to a faster healing and epithelialization. Cardiac and other tissues. Researchers have successfully bioprinted vascular structures, cardiac tissue with beating cells, and even a full heart, though these are still in the early stages of development. Drug delivery. Bioprinted scaffolds can be designed to deliver drugs, growth factors, or gene therapies in a controlled, localized manner. Biomaterials like alginate and cellulose act as carriers to protect and gradually release active ingredients. Drug screening. Bioprinted tissue models can mimic human organs to test the efficacy and toxicity of new drugs. This offers a more accurate alternative to traditional screening methods. Organs on a chip. Bioprinting is used to create organ on a chip devices that replicate organ activities, providing a platform to investigate potential pharmacological effects. Pros and cons of 3D bioprinting. While a revolutionary field, bioprinting has its own set of challenges. Advantages, customization, can create patient-specific organs and tissue based on their anatomy. Versatility, capable of printing complex, multifunctional structures. Reduced organ rejection. Using a patient's own cells can eliminate the risk of immune rejection. Cost and speed offers the potential for rapid and affordable production of tissues. Disadvantage, material limitations. Not all biocompatible materials are suitable for printing due to a lack of structural strength. Technical hurdles. Issues like nozzle clogging, low printing speed for large constructs, and limited cell viability remain a challenge. Vascularization. A major hurdle is generating a vascular network within printed organs to supply nutrients and oxygen to the cells. Conclusion and future outlook. Bioprinting is a rapidly growing field with enormous potential to fundamentally change medicine. While we are still a considerable distance away from printing a fully functional organ for transplant, the technology is advancing quickly. Future research is focused on developing novel biomaterials, improving printing resolution and speed, and better integrating bioprinted tissues with the body's vascular and nervous systems. As the technology matures, it promises to solve the critical organ shortage, reduce rejection tissues, and accelerate drug development, ultimately saving and improving thousands of lives. Thank you for listening to this talk. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel.